Back pain can be pretty excruciating and alarming as well. The good news is that much of it gets better without surgery. Dr. Vijay Vad is a physiatrist at the Hospital for Special Surgery, a nationally ranked center of excellence.
The numbers used to be, if you talk about 15 to 20 years ago, it used to be about 5% required surgery. The numbers today are anywhere between the 2 to 3% range.
Most of getting better is what you can do for yourself. Your pain should be getting better within days. There are 3 key steps: pain relief, back-friendly stretches, and aerobics. The idea is to control the pain to be able to exercise. These are Dr. Vad's recommendations, beginning with supplements. The dietary supplement, ginger glucosamine.
1,500 milligrams glucosamine, 1,200 chondroitin as a first-line pain control measure for back pain. If it doesn't work, you can go to anti-inflammatories. If that doesn't work, then you can use narcotics for pain control short-term.
Low-dose NSAIDs.
I think NSAIDs are fine for a pain control measure. They're not going to have any impact really on the natural history. They're not going to shorten the duration of back pain.
COX-2 inhibitors, Darvocet 100, Vicodin, Ultracept. If you've exhausted this list, or for more severe or difficult to control pain, there is an epidural injection, good especially for sciatic pain, offering up to 1 year's worth of pain relief.
The most important thing long-term for back pain is really that you get into a good routine of exercise.
Patients who don't exercise run a 70 to 80% chance of a recurrence.
But if you did stretching exercise regimens, then that recurrence of back pain within those next 2 years can drop down to 16% based upon our clinical trials.
Equally important is aerobic exercise. The kind of aerobic exercise you do depends on your diagnosis. If the pain is from a disc,
walking is one of the most effective and safest exercises. The tremendous impact walking has on disc health is that it creates what we call good compression in the disc, loading and unloading of the disc at a normal pace.
Swimming freestyle or an elliptical trainer is good for disc problems. And if you have spinal stenosis, you may have trouble with walking.
In the elderly population, in the senior population, they have trouble walking because they have spinal stenosis. So in that population, I recommend that they use a stationary bicycle to maintain their aerobic endurance because it's an important part of good back health.
For simple back pain that's not getting better, you may want to see your family doctor or internist. For specialty care, you may want to see a physiatrist like Dr. Vad, a rheumatologist, or an orthopedic surgeon for more specialized care and techniques. If your back pain doesn't get better or worsens with physical therapy, you may want to see a spine surgeon to determine if surgery makes sense.